What's up, everybody? Welcome to Sound Off right here on WJMS Media. This is your girl Jams, and I am so excited to be with you today. I have a really good show and a really important show for everybody out there listening. Before we get into that today, of course, I have a little bit of housekeeping announcements. For those who are interested, make sure you check us out on social media. We are at WJMS Radio on Facebook, Instagram, Snapchat, and Twitter. We also have TikTok as well, so go check us out there. We have video content up on YouTube where you can get to see some of the videos from these episodes and other content that we've done in and around the community. So make sure you connect with us there as well. I want to thank all the people that behind the scenes help make Sound Off and WJMS Media possible. Everybody on the team that supports me and everybody that tunes in regularly to watch the show and to give me support and feedback. Appreciate everybody. This episode is going to be a very important one. It's a super timely one based on what we're going on right now. We have going on right now. But I have with me Rita Allen. She's a registered nurse. I'm really excited to talk to her today. She is the owner and operator of the Infection Prevention Alliance in Savannah, and she's an infection prevention and control practitioner. She was a home care manager. She's got extensive and successful experience as a nurse and expertise in leadership in infection prevention and control. She's got her licensure in Georgia, and she's got experience in acute care, home care, hospice care, as well as management, occupational health. She's board certified in infection prevention and control. She's an infection prevention control mentor through GHA, APIC, and SHEA, which are in local professional networking groups. And she's got highly infectious disease training through FEMA and the Center for Domestic Preparedness. So I'm really excited with all of those credentials you have on your list here. I cannot wait to talk to you today, Rita, and go over all the stuff that we have on our list. So welcome to the show. How are you doing today?
Thank you. Thank you. I'm glad to be here. Everybody at home watching, hi there.
Absolutely. And so, folks, if you are watching on Facebook or YouTube, you can feel free to leave a comment on either of those pages that you see, and we will get your questions answered live on air. Comments as well, encouragement, whatever you guys may need, we will get it all addressed on air here today. So make sure you connect with us and share your name with social media as well so that we can see who you are when you drop your comments. Don't be anonymous. All right. So, Rita, I gave a little bit of background on who you are and some of your credentials, but why don't you give a little bit more of a bio of just, how you sort of grew up and how you came to be interested in infection prevention? It's a very interesting field to be in.
Isn't it? I grew up in Germany, actually, born and raised in Germany, and then was a nurse in Germany as well and practiced there for just a little bit. Fell in love with an American guy and came to the United States, and have been in Georgia for quite a long while. I'm sure you guys hear an accent. So the accent doesn't seem to be going away. But I practiced a little bit in Jessup. They have been really, really kind to me, and was really getting my feet wet in nursing in the United States. There are a couple of differences, and I was really lucky to be there with them. And then I started, as you pointed out, I was working in hospice care for a while. It was also wonderful, wonderful experience, both from the people I worked with and the patients I got to meet and the experiences I had. I got to work a little bit in management in that area. And then a position became available that included infection prevention. And if you work in smaller facilities, sometimes you bundle together infection prevention with other things, as it was there, occupational health and safety. And then a position became available at an acute care hospital in Georgia, in Savannah. And I started working there and have for a long while. And then, as you mentioned, I branched out a little bit. So I have a consulting firm, infection prevention related, and help also the state a little bit with some things to support infection prevention as mentor, provide education and support. So it's been very rewarding.
That's awesome. Yeah, I'm thinking to myself, like, you know what? This has got to be your D-Day right now. Like, to be an infection prevention person in the middle of COVID is like Like it doesn't get much more experience than that, right? I mean, it's got to be, it has to have, really been kind of crazy dealing with all this, right?
Yeah, there's this love-hate relationships. Obviously, infection preventionists have been thinking about pandemics and public health, epidemiologists, all those, all people and professionals that have some infectious disease experience and work with that every day have been thinking about how we would react to a pandemic long before we had a pandemic.
Hmm.
The stockpiling, the how would we house patients if we had a lot of patients come in at the same time overnight? How would we handle that with public health, with the hospitals, with other community organizations, and all that. So we've been talking about that and thinking about that for a long while. So it's actually, I don't want to be misunderstood. It's an interesting experience to go through that. Are we frustrated and tired and worried, and use all of our abilities, all of our resources, all of our, every cell is thinking about and working on the pandemic and keep everybody safe? Absolutely. It's also good to see how well we work together. How well hospitals and community organizations and the public health and scientists and how the whole healthcare community is coming together, and community organizations are coming together to do the best here. So, there's sort of this love-hate relationship with data as well.
Yeah.
We hate that we have to report it, but on the other hand, we rely on good data to make decisions, right? So, yeah, it's an interesting experience in a lot of different levels.
So, you know how they say the plumber's house has bad plumbing and the electrician's house has bad electric. So I got to ask, as an infection control person, have you had COVID yet, or have you been able to avoid it?
I have not had COVID. Somebody knock on wood.
Yeah, I haven't either.
Thank
Knock on
goodness.
wood.
Thank goodness. But I have to tell you, I have made some tough choices through the last 2 years.
Hmm.
When everybody else makes those choices, people in healthcare had to make the same choices, and sometimes even tougher choices. When you think about in the beginning, now we know so much about, there's always more to learn, but we know so much about um, Omicron and all the different variants and how we reacted to them, what the best way is to isolate people, what the best way is PPE use, which we have been using before, but how do we use it best here, and what PPE we use. But when we first started in this pandemic, and we didn't quite know, we knew it was highly transmittable, but you had healthcare workers that rightfully were worried about taking this home to their families.
Hmm.
And they didn't stay home. They came to the hospitals and to the doctor's offices and to the outpatient facilities, and we took care of patients while worrying taking this home to their families. So, I guess this is a shout out for all the healthcare workers, all the people that I've worked with, and all my colleagues near and far in the United States, in Georgia, and across the globe that have and continue have in the past and continue to respond and be on the front lines and do what needs to be done, and do it professionally and with care and with compassion.
Yeah. Well, so let me ask you this, because I mean, if you've got a long history of dealing with infection control and prevention, so I know we had the swine flu and the H1N1 outbreak that happened, a couple years back there. How was that different from this? Like what kind of things were different about that whole situation than were different about COVID here? In terms of like prevention or, just information, treatment, stuff like that kind of difference, I guess.
So I think the different, obviously it's a different virus. It's flu and not a coronavirus.
Yeah.
Um, we had the vaccine fairly quickly, which we did with COVID as well, but there was just a higher transmission going on with COVID. And the other part to this is in the beginning of the pandemic, we really didn't have the resources of um, testing for COVID. So, we could test for flu and for RSV, and for other coronaviruses, but it had to be developed to look for this particular coronavirus or the variants, and then distribute that technology. So in the beginning, we were not, the hospitals. Not every hospitals had tests to test for COVID.
Yeah.
In the very beginning, we had to send the tests in. So, you know, we take it for granted now that we can test. We take it for granted, but in the beginning, it was a different ball game. And so, with H1N1, we were able to test, and the transmission was less. Right? We had less people infected than we do now. We had less deaths than we have with COVID. It's definitely a different ball game. COVID is definitely a different ball game.
Absolutely. And that brings me to my next point that, as I was researching this conversation today, I thought to myself, I'm like, this isn't the first time that the world has gone through a pandemic situation. And we've had these situations happen before with plagues and all kinds of other things that have swept through and wiped out, entire, just generations of people. And so I wanted to bring some of that stuff to the air today to tell folks and remind folks where we've been, to let them know that this is not so new to what we've dealt with before. And so, the first one that I'll go over is the plague of Justinian, which was in Constantinople. And it was in 541 CE. It was carried over in the Mediterranean Sea from Egypt. And it was basically plague-ridden fleas that were on the back of rats, that were eating the grain that people were eating in the world. And so that plague decimated Constantinople and spread like wildfire across Europe, Asia, North Africa, and Arabia, killing over 30 to 50 million people, perhaps just about half the world's population at the time. So that was one of them. You got the Black Death that happened in Europe in 1347, which claimed 20 million lives in just 4 years. And, for how to stop that disease, scientists really had no understanding of contagion. All they knew was that it had something to do with like people being in proximity to each other. So they weren't really sure, but that's all they knew. You've got the plague, which resurfaced every 10 years from 1348 to 1665. There were 40 outbreaks in just 300 years. And with each new plague, 20% of men, women, and children living in the British capital were killed. People had no real understanding of how to fight it. All they knew was they needed to avoid sick people. So everybody just kind of stayed away from people with the plague. That's kind of where that phrase came from, avoid people like the plague. That's where that whole phrase came from. So in 1665, that was the last and the worst of the plague, and it killed 100,000 Londoners in just 7 months. All public entertainment was banned. Victims were forcibly shut into their homes to prevent the spread of disease. So that kind of sounds a little familiar for what we had, back in 2020.
Yeah.
You've got smallpox, which was another endemic in Europe, Asia, and Arabia for centuries. And it killed 3 out of 10 people it infected and left the rest of people who got it with scars. The indigenous people of, modern day Mexico and the United States had zero natural immunity to smallpox. So the virus cut them down by the tens of millions because they never experienced it before in their lives. And so it just cut straight through everybody. It would say, I think they said the number, let me look at the statistic here. It said 90 to 95% of the indigenous population was wiped out in over a century. Mexico went from 11 million people pre-conquest to 1 million people. That's how many people were killed by that one endemic. And so now, centuries later, smallpox was the first virus epidemic to have been ended by a vaccine. And so all of these things I put in the conversation today to say this isn't our first time at the rodeo, people. We have had these kind of situations before where we've had mass outbreaks of these sicknesses, these viruses, these flus, things like that. The only difference is we know what to do. We've got the science. We have the technology. We have everything we need to sort of fix and solve the problem. We just don't want to do it. A
couple of things to that. So great research. That's awesome. I love it. So, but you know what one thing you said is, they stayed away from people and whatnot. So we do that many a mini thing of that when patients come to the hospital and we isolate them, we wear the right PPE, the right personal protective equipment, the right masks, face shield, gowns, gloves, in order to protect the healthcare worker.
Yeah.
But really, when you think back on the very beginning of the pandemic, this pandemic, when you think about the very beginning, the first thing we heard, the first indicator that we're going to have a pandemic or that there's something unusual going on is we heard about unusual unidentified pneumonia in Wuhan city.
Mm-hmm.
Remember in the beginning they thought this is all from this market, that large market in Wuhan city, and it wasn't really clear, is there person to person transmission. And then, we had to figure all that out.
Mm-hmm.
Was it coming from an animal or was it person to person transmission and all that? That makes all the difference on how easy can it spread. And, if there's person to person transmission, how easy does that spread? And we see with some of the variants now, some are spread much easier than others do. So, as we were going along, so you have to figure all this out. But when you really think about the 1918 flu pandemic, some of the interventions they did then, we are doing now. And you mentioned some other pandemics. You stay away from other people. You wear a mask if it's as if it's an airborne transmission, and whatnot. So distance matters, ventilation matters. Yeah.
It's one of those. It's weird because I mean, at the beginning of all of this, I remember when it first started, and everyone kept flip flopping, and nobody understood what was going on, and everybody was confused because one minute they would get on TV or on the media and say, "Hey, this is how it's transmitted," and then they'd be like, "Nope, sorry, we were wrong. It was transmitted this way." "Nope, sorry, let's go back to what we said originally." And so there was so much back and forth that I think it started to cause a distrust of the scientists at the end of the day, because they were like, y'all don't even know what's really happening and why this is going on. And so that doesn't help. And I know that like social media nowadays can both help and hurt in terms of getting information out, because people get the wrong information and run straight to everybody.
I agree with you. I so agree with you. I'm not a scientist. I rely on scientists to give me the evidence, right?
Yeah.
And then I look for CDC to give me the guidance on what I need to do, what information I need to disseminate to healthcare workers that I'm responsible for, to be sure that they are safe when they take care of patients that are coming into our healthcare facilities. And in the beginning, there was, we had to figure things out. We had to see how it's transmitted and whatnot. Although very early on, there was a strong indicator that this is transmitted person to person and that it's a respiratory virus. And we acted accordingly.
Yeah.
And then we heard, it's really important also to wear gloves and gown because it can stay on surfaces. You need to disinfect. Obviously, we do that anyway, but we got more evidence for that. So I don't want to call it flip-flopping because we had to figure things out. We had a roadmap and we were, I guess, fine-tuning it a little bit as we were going along. But I do think that sometimes in media, there are people giving microphones that talk about it like it's their expertise. And it may not actually be their expertise, if I may say that. But, I rely on scientists and CDC and other scientific groups to help me educate in the right way and guide.
Absolutely. And so, based on that, I know that you have a presentation for us of some numbers of COVID now and currently. So, do you want to share that with the audience now and kind of go over
Sure.
the research that you have?
Sure.
Great. So, folks, she has a presentation for us of some of the numbers of COVID and just what's going on. We have some numbers that are specific to Georgia for those folks who are listening, and so please take note and just watch while we go through these slides here as she explains some of this stuff. So, stand by.
All righty, you should be able to see this now. Are you seeing this?
Yep, we can see it.
All righty. Well, just a moment ago, I added this when we were talking before the show. So, yes, there are pictures of the 1918 pandemic. And you see here, it's although they are not social distancing, these are healthcare workers, but they're wearing masks. So even in the 1918 pandemic, that's what we did. This is in San Francisco, an open air police court. So they understood that ventilation is important if you have a respiratory pathogen. They understood how it's transmitted and how you can mitigate some of that. Mm-hmm. And then, keep the bedroom windows open to prevent influenza, pneumonia, and tuberculosis. And then also the call for nurses to come into the profession. But I wanted to give you guys, so when we, you talked a little bit about, or you touched on why we're not doing what we know we're supposed to do.
Yes.
I think that some of this is fatigue. Yeah. I think that some of this is, we've done it for so long. When can I finally take off my mask? When can I socialize again? So, I talked earlier about how I made some hard decisions throughout the pandemic. I'm a table tennis player. And when the table tennis club opened back up, I did go back to play. But when Omicron started occurring, mm-hmm. I stopped, even though I was wearing a mask when I was playing, which is tough, right? But and you are fairly far away from people. They're on the other side of the table, but you do, you are pretty close together in some instances. So I decided not to play anymore. To keep myself safe and to keep others safe. What if I were to be infected, asymptomatic, but give it to somebody that may become symptomatic and may even die? I don't know what the background is of a person that stands next to me that I'm talking to. I may infect them and they may end up in the hospital and die, which is the cold, hard fact and sadness of this pandemic. So globally, if you look at this here, so you see on the left, globally, how many cases we had, how many deaths, and how many people have recovered. Just look at, this graph here is really showing how aggressive Omicron is. So this is the Omicron wave.
Oh, wow.
And look, we've talked about the pandemic for that long, and look how high the Omicron wave is. Even considering that some areas of the world don't have access to testing like we do. We are really lucky of access to testing and access to healthcare. Most of us have, not all of us, but most of us have. So we're finally seeing a nice decline here. But look, we're still so much higher than we were before the Omicron wave, right?
Yeah, absolutely.
And then always, when you look at, when you compare the cases and deaths, you always see when you see the daily new cases declining, you still see daily deaths increasing, unfortunately. So death decrease usually takes a while after you see decrease in daily cases. Then it takes a while until you see decreases in deaths. Unfortunately, that's true and has been true throughout the pandemic. Mm-hmm. Coronavirus cases in the United States, there's unbelievable numbers, and look at this Omicron wave. Wow. When we're talking about we had a lot of cases, and we didn't have that many deaths, or when people say that, just look at that. If you're comparing how many cases we had here and here, we had more deaths here than we had in this wave.
It's true. And now I have a question for you with this slide. I mean, You see the coronavirus cases at 80,532,000 and recovered at 52,866,000 with just about less than a million deaths. So what is the other, or where are the other 27 or however many, million people, where are they in this? Like, where are those numbers? What does that stuff mean?
Some are still infected and sick.
Okay. Wow.
And then, so this is from Worldometer. I love the Worldometer website, not just for COVID, but for other things as well. If you're a little nerdy about data and global data, it's a great website. But this is some data from the Worldometer website. So the 15 top states in the United States with total sorted by total cases, and you can slice and dice these data in a lot of different ways, but just for total cases, and then you see the new cases, how many we had. Obviously, this is just a total number. There is a way on that website to also make it by 100,000 population, etc. So it's a different way of looking at this, obviously. And for Georgia, so on the left you have the graph with the last all the waves that we had so far, and then the last is the Omicron wave. So you see here on the bottom that we are pretty close to where we were before before the holidays.
Yeah.
And not quite where we were before July 4th. And when you talked about we know what we need to do, I need to just tag on to this just a little bit. You remember that in July, and I love CDC. They have done a lot for us, and I rely on them every day. But you remember before July 4th, there was the notion of if you have been vaccinated, you can take off your mask and whatnot. If everybody has been vaccinated in the family or whatnot, I don't remember what the wording was, but there was encouragement that you could take off your mask, and everybody was happy about that. And look what happened after the holiday.
Yep.
And then you see here, this is before Christmas and New Year's for those of us that have celebrated, or, even if you're not celebrating Christmas, there were a lot of get-togethers, right? So here again, we were, I think, getting complacent or just being happy that things are letting up. And understandably, we're happy, and understandably, we're looking for, can I just take this mask off? It's just too early. It's too quick.
Yeah.
We need to have a time of, hardly having any cases before we do that. My personal opinion. I know there are CDC guidelines, and please follow those. But my personal opinion is now is not the time to take off masks.
Yeah.
And then here, confirmed deaths reported in Georgia. So you see, we're finally seeing a downhill trend. But over here, you see all this downhill trend in new cases, but now finally a little bit of declining trend in deaths. And I also need to say, as I present these data, I want to be sure to point out, while these are data points and they're important to look at the way we're looking at them now, it is also important to remember that these are real people.
Yeah.
These are real people that were affected by COVID, that may have long COVID. You've probably heard of that, how it can affect some people over a long period of time. And that's obviously being studied. But each one of these people over here that has died is somebody's mother or father or sister or brother or sibling, or, they are important to somebody. So they're not just a number.
Yeah, that's true.
The other thing I want to point out is, this is where we were when we did shelter in place in Georgia.
Wow.
All right, Chatham County. Chatham County, so you see a nice decline here, almost like before we were the holidays. Nice decline in community transmission index, but still in the red. This is historical community transmission index. So you see how high the index was during the Omicron wave.
Yeah.
Almost back to before here. we're back in the yellow finally of positive tests. I always say when I present this, be careful about this because now we have, there may be people that don't want to get tested that are positive and stay at home, or there may be people that are now doing the home tests that are available.
Yep.
So that they may not be captured here. A nice decline in cases that are being seen in the hospitalizations. And then those are new guidelines from CDC, prevention steps you should take if you're low, medium, or high. So they changed the way they look at community indexes. And this is for Georgia and for the United States. So you see here Chatham County is now in the low group.
Right.
And just because I'm always getting questions about variants, and do we really know that Omicron is so much more infective than another variant? So this B16, so, there may be people interested. Some people may go, no, I don't want to hear all that. But I get a lot of questions about this. So this one is what we used to call, what is Delta variant, this orange color. You may remember that they called it the UK strain some time ago.
Mm-hmm.
And we saw over time, this is CDC data, we saw over time that it was boxing out all the other lineages and variants. So we saw how aggressive it is. And then just in a couple of weeks, Omicron was taken over. So this color and this color are Omicron variants. And down here is this B2 that seems to be significant now. So there's still a lot to be learned about variants as they emerge. Obviously, there's testing going on and careful watching of how it occurs in other countries, and how virulent it is, and how easily transmitted it is. But we certainly are keeping an eye on that. Vaccination, can't do a presentation about vaccination. So this is a fully vaccinated. Obviously, boosters are important. So talk with your healthcare provider about vaccination and getting booster doses, and they are available in the community. Questions about masks. Are masks effective? This is what it is. There's actually a study being done about this. So, I'm wearing my mask not just for me to protect myself, but I'm wearing it to protect other people as well. Source control. We know that masks work. And this is an early publication from CDC about an outbreak that occurred. There were 2 hairstylists that were actually infected with the initial COVID or SARS-2 virus. And they were working while they were infectious, while they were symptomatic. We obviously wouldn't advise that, but they were working while they were in the infectious state and while they were symptomatic. But they were wearing a mask. And look at how many people they had in contact with. They spent time with 139 clients. Wow. And at least 15 minutes, and they did not infect one person.
Wow.
It speaks to what masks can do. So anyway, that's why I'm an advocate for masks, and I'm hoping that you guys are considering wearing a mask. It's a small thing to do. I know that it's a little bit frustrating that it's not time yet to take masks off, but I think it's such an important intervention to keep yourself safe and keep other people safe.
Absolutely.
Anyway, I hope that was not too long.
No, not at all. That was really, really good, and that was great information. All the charts were amazing, and all the info was wonderful. And it's funny you say that, because you were talking about when we were sheltering in place and stuff like that. I moved to Georgia from New York in April of 2020, right? In the midst of the pandemic, I was like, I'm out. I packed up and I left. I remember when I left New York, stuff was shut down. Like, businesses were closed. My job was closed. They were just in the process of shutting down Times Square, like fully shutting down Broadway. And It was weird. It was very strange. It was like, I don't know if you've seen any of the horror movies where they, like, empty out all of New York of the cars and the streets are just
Mhm.
empty. It looked like that, and it was weird. And I moved down here to Georgia, and it was like nothing happened. And I was just like, are we not in a pandemic down here? I was confused because businesses were still open, stuff was still happening, like, everything was there was slight changes, but everything was still happening, like, I mean, there was the mask mandate and all that kinda stuff, but it just really felt like 2 totally different worlds, and I just feel like there wasn't a lot of consistency. I can't speak for other countries, but I know in the United States, there was not a lot of consistency on what was happening. Like businesses opening, closing, mask mandates. Some places had mask mandates, some places didn't. Some places shut down businesses, some didn't. And so I just felt like I think that's where we misstepped a little bit. Like I think that's where we messed up a little. Was not having that consistent mask mandate across the board with all businesses. Um, and keeping it in place because I also feel like you said that we lifted it too soon. And it got to the point too where I'm like, you know what? The CDC just said, hey, if you've been vaccinated, you can remove your mask. But I'm like, there are people that have not been vaccinated who are like, well, I'm taking it off anyway. Like, who's gonna tell me? How are they gonna know? So that there were people
Which
that were
was
not.
not what CDC was, which was not what CDC recommended. So
Yeah,
I do want to be sure. I love CDC, and I know that they try to balance it all. It's a balance in infection prevention sometimes, right?
yeah,
We want to be sure that everybody is safe. We don't want to be doing something that is too stringent, but we want to be sure that everybody is safe. So I understand the notion that you want to try to see where can we loosen this a little bit. I understand it. I understand the frustration because I felt it too. I still feel it
yeah.
sometimes. I still feel sometimes, my goodness, I have to put this mask on. But, it's just not. I hear what you're saying as well. I was frustrated too with, a local government can do something different than the state government can do something different what the feds are recommending. Um, I wish that was different as well. It is what it is. I'm pleading to people to continue to wear their masks.
Yeah.
I cannot control anybody, and I don't want to control everybody. But all I can do is show you what the data is. And when you really think about how long after we are seeing a decrease, should we remove something? This is how I'm thinking about it. So if I have something that is, if I have a virus or some infectious agent that has a certain incubation period, meaning once I'm infected, it takes me whatever how long to develop infection and to transmit it, right? So let's say it takes me 10 days to do that, depending on what infectious agent you use. So 10 days, let's say it takes me 10 days to become infected. Then I have a certain period where I can transmit it. If, let's say, at the end of that transmission period, I'm infecting people, you're starting that over, right? The other people are going to have that time until they get infection and then when they transmit. So, we've seen with Omicron and with COVID over and over that just because our numbers are looking a little bit better, it's not right then the time to loosen up on our prevention efforts.
So, do you think we're ever going to get past this? Are we ever going to contain this, situation, or is this something that's just going to continue to develop forever? And this is the new normal.
Hmm. It's a good question.
It's a hard question, I know.
It is. I tell you, I'm hoping that we get past it. I'm hoping that there will be a variant that is emerging that is less easily transmitted and is less virulent, so it doesn't cause death. Something like a cold virus. I'm hoping that there's something like this that will emerge. But whenever we've seen a new variant emerge, it was more easily transmitted, right?
And why is that?
Whenever we saw a new variant emerged taking over like Delta did. It was more easily transmitted than the one before. When Omicron emerged, more easily transmitted than the one before. So
Why does
I
that
guess
happen?
I guess the others can just can't survive.
Yeah.
Um, I guess it's just law of nature. You wouldn't survive if you can transmit to other people. And that's really what we want to do with our infection prevention efforts. We want to interrupt transmission. So, you know, it's a hard question. I'm hoping that we get to a point where we have a variant emerging that is easier for bodies to handle, easier for our immune system to handle, um, and less easy transmitted. Um, the data we have so far is not showing that that's going to happen, but um, I think we need to stay strong with our interventions and keep protecting each other.
Yeah, absolutely. And to give the audience a couple of statistics, researchers found that Omicron is about 2.7 to 3.7 more times more infectious than the Delta variant in both vaccinated and boosted people. So just be safe out there. Please wear your masks, like she said. Wash your hands. Continue to use hand sanitizer. It's not the time to loosen up on what we've been doing. That's just going to send us back even further. We have to continue on the path that we've been setting forward to get the results we have. So I want to talk a little bit about what you do with the Infection Prevention Alliance in Savannah. So, what was the reason for starting that, and what are some of the initiatives that you guys are working on around COVID, and maybe even other things that might be coming up in the future?
Mm-hmm. Yeah, so Infection Prevention Alliance is just me. It's just a small business. It became about sort of in the first year of the pandemic, sort of half year in. Um, I've received both on my full time job and after hours just an unprecedented amount of phone calls and people reaching out and asking what the best approach is here. You know, before we had CDC guidelines and whatnot, I've received a lot of phone calls and a lot of inquiries about, just asking my opinion on what the best approach would be. And at some point, a friend of mine said, "Why are you not charging for this? This is your expertise. Why are you doing this for free?" And certainly, you want to be helpful. If I'm not needed through a pandemic, when am I going to be needed? And obviously, I'm doing this because I have compassion and I want to be a good steward to my community and to my friends and family. Um, so anyway, I started it there. I wasn't really doing a whole lot of having a lot of clients or anything like that. More recently, I've started working with some regions in Georgia to help support infection preventionists. I love mentoring new infection preventionists. And not a lot of people even know what an infection preventionist does, right? So sometimes in smaller facilities, there may just be one person that does that, which is a resource to healthcare workers, a link to leadership in the facility, a link to the community, reporting infectious diseases, providing data, and keeping up with the most recent best practices for infection prevention. So sometimes there may only be one or two people working in a facility, and I want to be sure that the new IPs that are coming up and choose this line of work have the right resources, and Georgia is certainly supporting that, and I'm help support Georgia to bringing that to the infection preventionists in the community.
Good stuff. And so I'm thinking to myself, like, this has got to be your Super Bowl. This is the game right here for you. This is how you put everything into practice. So it's kind of like learning something and experiencing it. It literally is like going through schooling for something specific, like being a vet and having some poor animal come in that you have to triage and do stuff on, like, or being a doctor and having somebody code in your room, like, this is the test, ladies and gentlemen. And I just feel like you've been in test mode for years, 2 years now at this point. I know you've got to be tired. So, what kind of information or what kind of, I guess, I guess advice do you want to give to the general public about COVID infection prevention, and just how we get past this pandemic? What would, if you could wrap all of this up in a bow, what would you tell people?
So I think all the things that CDC and Dr. Fauci and all the great minds have been telling us over the pandemic really comes down to a couple of things, which is social distancing is important, vaccination is important, and I know vaccination doesn't prevent everything, it doesn't prevent transmission, but it keeps you out of the hospital and it keeps you from dying from it. So follow the best guideline on when to get vaccinated and when to get boosted. Wear your mask and stay home when you're sick. I think obviously we can transmit before we ever get sick, before we show symptoms. But once you know you have symptoms, you feel bad. We have people that are positive for COVID, just having a headache, a severe headache, or have pretty mild symptoms and think this is, I have, I don't know, allergies or something like that. So if you have symptoms, you feel bad, stay home and get tested if you have access to testing. Don't expose other people. Wash your hands and keep your hands out of the face. The things that our mom already told us many years ago. So, the one way of transmitting is through your hands from surfaces to your face. So wash your hands before you touch anything around your mouth. Obviously, the mask is a deterrent if you're touching your nose and face as well. And then surface disinfection. At home, I tell you, I don't use a disinfectant at home. I just use elbow grease and a good detergent, but every once in a while, I use a little bit of a disinfectant at home, like for doorknobs and bathrooms that other people use, not just myself or not just my family. So all those good things, those are pretty basic things, but they do work.
Yeah.
Don't
And
let up.
I was thinking too, you mentioned about the home testing, and my concern with the home testing, I'm glad that they did that where they're like, hey, we're going to send out home tests to everybody. I think that's great. But I'm worried that it's going to lull people into a false sense of safety, because those people who are testing at home and who test positive at home are not reporting that information to the CDC. They're not reporting that information to the doctors. And so that information is largely not getting noticed or getting accounted for. So when that happens, our numbers go lower and people think, oh, we're doing good, things are good, things are good, when in reality that might not be the case. And so that's my last thought about all of this, is just that I worry about the home tests and how that's going to affect data collecting for, tracking numbers and just seeing where we truly are as a country, with COVID. So
It has a lot of good things too, though. If you have somebody that has very mild symptoms, obviously, if you think you have a cold, even if your COVID test is negative, your home COVID test, you still should be staying at home, or if you have a fever and that kind of thing. But, sometimes it may just be that you're ruling out, is this an allergy or is this COVID?
yeah.
It can mimic so many other diseases and clinical symptoms. So sometimes it's really helpful to help rule certain things out. So, the pros and cons to everything, but I think it's great that that households have ready access to it.
Yeah. I mean, I've had two colds, I guess, whatever. There's something aside from COVID, there is some very contagious flu bug or something going around. There's something else that's not COVID. It's just a cold. It's a regular cold. And
Right.
that thing has been circulating around, and I think I've caught that bad boy twice. And I'm just like, "Oh my god." Every time I'm like, is this COVID? Is this COVID? Is this COVID? And the weird thing for me, and I'm going to ask you this cuz you're a professional. So, the weird thing for me is that when I get sick, I lose my sense of taste and smell anyway. When my nose gets stuffy, I can't taste anything. That's always been me since I was
Mhm.
forever. And other people are like, no, that's not true. No, that's not true. I'm like, yes, it is. So now I'm freaking out thinking that maybe I'm strange because I lose my sense of taste and smell when my nose gets stuffed up. And I just need a professional ruling on this so that I can put myself to sleep at night knowing that I'm okay. So, what
So
say
I
you?
think, I think everybody is different. Some people have um, not a not a great sense of taste and smell anyway, and certainly medications can interfere with things. So there are a lot of different ways, and some people don't lose their taste of smell and taste, even when they have COVID. So
Yeah.
it's just one of the indicators, one of the symptoms we look for. Certainly, people don't have to have all of those symptoms in order to have COVID. So yeah. I think, one other great thing that the home testing does is, besides looking at data of people that are hospitalized and people that are in ICUs and are dying from COVID, obviously that's very important and sad. But the other part that home testing does is we have a lot of emergency departments and immediate care centers and whatnot that have had some really difficult time with people coming in that are suspected to have COVID. And if you have really mild symptoms, no underlying illness, you're not having shortness of breath, obviously, very mild symptoms that you can manage at home. It's a great thing that you can rule out at home what this is and don't have to go into a facility to get tested. So, it helps the whole staying away from other people
Hmm.
notion, right? So, good and bad. Obviously, we have to think about, do we have people sick in the community, and we don't capture that because we don't report those through a central lab, like you said. But yeah.
Yeah. Well, we're coming up on the end of the show here. I want to give you the opportunity to give everybody your contact information. If people want to get in touch with you for the Infection Prevention Alliance, or if they're just interested in maybe talking to you about, other situations that they're dealing with in terms of COVID and infection. So, where
Yeah.
can people get a hold of you, or what's the best way for people to get in touch with you to get more information?
So you can email me. That's pretty easy. It's Rita Allen 654 at att.net. So RITAALLEN 654 at att.net. Or you can text or call me 912-429-0516. And certainly, if any infection preventionists are listening, I would love to hear from you and would love to give you some resources if you're looking for some. Always ready to hear from you.
All right. Well, Rita, I want to thank you for being on the show with me today. Thank you so much for sharing that entire presentation and all your wisdom with
Sure.
us. I think it's been really, really helpful to hear from somebody who is working in the field, what needs to be done, what needs to happen, and why some of the things are the way they are. So I appreciate you taking the time today. It's been a really, really, truly a pleasure talking to you. And I look forward to connecting with you. And hopefully we don't have to speak again. Hopefully this whole thing goes away and we won't have to have another conversation in a year or two. Yeah,
Thank you. It's been my pleasure. I appreciate you having me on.
absolutely. And folks, I'll be back with another new episode of Sound Off, so make sure you keep it locked to WJMS Media. In the meantime, connect with us on social media. We are at WJMS Media on Facebook, Instagram, Snapchat, Twitter. We are on TikTok, and we have content on YouTube as well. You can check out our website at WJMSradio .com for more information and connect with us there as well. So I want to thank all the folks behind the scenes that help make the show possible, all the people that tune in and listen, to the folks that left comments on the screen here. We appreciate you. Fraser, all the way over in the UK, tuning in, saying hello. Frank Knox here in Georgia as well, chiming in. Also, appreciate you guys. We'll be back again with another new episode. Until then, like Rita said, everybody stay safe, wear your mask, wash your hands, and hopefully we can put this whole pandemic behind us. See you next time.